Head and neck cancer patients can sometimes experience voice or swallowing disorders. Dr. Apoorva Ramaswamy is here to tell us more. Dr. Ramaswamy, what are head and neck cancers?
Because this is such a complicated anatomy, there really is no routine type of cancer in this area. You can have cancer on the skin, in the nose, in the throat, on the vocal cords, and even in the upper esophagus. These treatments, while wonderful, do result in long-term consequences in terms of voice and swallowing issues. The valve that separates our nose from our throat can get weaker after radiation to that area. We're able to prevent liquids and food from coming up into the nose during this chewing and swallowing process. At the James, we are blessed by having a very big team, swallow therapists, we have physical therapists, we have dietitians, we have social workers, and of course myself as a throat surgeon for both the treatment of cancer and ensuring quality of life of our patients afterwards.